I first heard of it on Twitter, I'd say November, December 2019, when it very first was happening and occurring in the Wuhan province. I remember going to the, what's it called now? Newfields, Indianapolis Museum of Art, for the Kusama exhibit in late January and seeing a group of school children with masks on. And that was the first time I thought, okay, is this something that we really need to be worrying about here? Is it going to travel that quickly? But really it was more personally that I was thinking about it. I hadn't even thought about it in regards to work yet. And then I believe it was the end of February, 1st of March, that I said, okay, we need to start figuring out what we're going to tell folks we're going to do. I was still worried about finding some panelists for some upcoming Science on Screen events that we were having. And I remember having a meeting with someone at Wonder Lab, and it was the first time that I elbow bumped someone instead of shaking their hand. But we still were all sort of thinking, okay, we'll just wash our hands and not shake hands and everything will be fine.
I can't really remember the exact first time that I heard about it, but it was in December, and I think it was in mid to late December. I have a couple, it's not like high security access, but I have like some network, epidemiological exchange networks that the CDC promotes and pushes out in their daily emails. And I think they posted something in their media tracking report about cases of unknown viral pneumonia in China. That piques your interest anyways. I nerd about, and I like completely nerd out about this stuff generally. People often joke that, you know, I got to play Pandemic, or like, this is what I wanted. And it's like, no, not really. But like part of, I teach a class in the O'Neill School, formerly SPIA, about environmental health science, and like one of the big tenets of that class is like looking at health through ecological model, and we really harp on like pandemics aren't a matter of if but when. And so disease surveillance has kind of always been part of our job at IU, but it's been like, you know, maybe 6%. But when I saw that, it's like, that's interesting. It might have stemmed from a seafood or wet or animal market, and like those are the things, that's how SARS started in 2003, and it's like those are the things that are going to cause the next pandemic. So that was alarming, and definitely paid attention to it. I remember it was Martin Luther King Day weekend, and so it was January 20th. And the news just kept getting a little bit more frightening to me, especially again knowing where it's coming from, and if that's coming out, then it probably is worse than it is. And it was CBS This Morning. I remember Nora O'Donnell and saying like there was like 4 things that had happened. Case counts quadrupled. China confirmed human-to-human transmission. And you're like, oh shit, okay, that's not good. And there was imported cases, I think, to 4 other countries identified. And so that's when I freaked out, was off work, but freaked out officially, I think, that day, and then went to work the next day and wrote up a summary to kind of inform others.
When it really hit home was when that first patient was admitted with symptoms to our emergency department. I'll never forget that day. My chief medical officer, my chief nursing officer, our infection prevention specialist, myself, my chief operating officer, we all went from the ED, where that patient was, up to the floor where we had established a unit where we could house patients with our negative air pressure and all the supplies and everything we needed. And I'll never forget the look on the staff's faces. That's what I was most concerned about. We deal with patients who are sick and need to be in isolation, hundreds of them a month, every day. And so that wasn't so much my concern. My concern was for the staff, and were they protected? Were they ready? Did they feel like that we had their back?
I actually was at work,
and we had just had a really large event the day before. We were kind of all in the room debriefing. There was, a couple of us on staff. We had our intern there, and we were on like a staff-wide phone call, and my boss was telling us, hey, this thing is happening, and we can't have unnecessary people in the building, so all interns have to go home. And my intern just kind of froze and was like, do I leave right now? What's going on? I don't think we really understood what was happening. And I remember thinking, oh my God, everyone is overreacting to this so much. Like, whatever, I'll just stay home for a couple weeks, work from there, and we'll be back on the job. And how very wrong I was.
Well, I think especially with something this big, there is lots of fear, right?
Mm-hmm.
And we never want fear to drive our actions. We want to be calm and think rationally about what we're doing, because if we let fear drive us, then we don't think as rationally. And so we want people to remain calm and to look at the information with something new. There's lots we don't have. There's lots of information we don't know, and that's what you build with science, right? It's the building of information, and so it's going to change. It has changed over the year and a half, and it will continue to change as we learn more about it. So it's really about telling people you should expect that we're probably, the way things are going, we are going to have cases. This is going to impact us here. And certainly knowing that people are getting nervous, that and that fear, they start worrying about you, or do I want to be with you, or now you've coughed, now I'm worried about being next to you, and there's probably still some of that, but back, in that early part of 2020, it was a huge fear, and there are a lot of ways. Things like this, analogies are hard, but that fear takes me back to the early 80s and HIV and AIDS.
And I've told this story 1,000 times, it was really about 2 days total time where we were like, ooh, okay, let's just, what is this? How just understanding as much as you could about what was going on. And then after that, organizationally, we made a firm decision that we've got to get back to serving kids. We do. And the whole team and our board of directors aligned with that we were going to head down a pathway to get there. But early on, recognized that was not going to be an easy task, right? There were members of our team that were, heck yeah, give me the flag, I'm going to run up the hill, I'll do this right now. This doesn't scare me at all. I can see it for what it is and I'm going to go. And other ones who were like, hell no, I won't go. I'm not going to step into that club. I'm not going to put myself at risk and my family, et cetera, et cetera, et cetera. And somehow bringing all of those people together, board members included, that were in that same spectrum. It was probably it was the most special 6-week time frame that I've ever worked, where you worked such difficult relationship stuff, and you worked down a plan to do something that no one else was doing, right? No one else in this community was doing it, and we were going to go, okay, we're going to go in the game here. We're going to serve kids face to face in a room and get this done. And it was exhilarating. It was scary. It was exhausting, but the product and the results were, I think, again, in my time as executive director, and I think when I'm all done, I'll look back and this will be my proudest moment as executive director.
One of the first things we had to do, along with restaurants, is close our dining room when it became apparent that the in-person eating and people congregating was an issue. We followed suit with that, and we actually adapted fairly well to that, because we have our main location where food is prepared and served with the dining room, but then our other now two locations are carryout. So we kind of knew how to do the carryout thing. It was, a little bouncy at the beginning to, make sure we had containers, because they're very quickly, and we kind of beat the gun on that too, was stockpiling a little bit of biodegradable containers, which incidentally we switched to, because once we realized we were going to be putting food directly out onto the streets, we were concerned with using styrofoam and that type of thing. So we switched to biodegradable containers. And it was, relatively easy as far as our facility to just switch to carry out. The other aspect, of course, was volunteers. So we have, and a lot of volunteers, as you can imagine, are people that are also fairly at risk. A lot of seniors, retirees, people with health issues, oftentimes people that, have been touched by the hunger issue and, want to give up their time. And so, it was risky for them also to be able to come in. It was risky for our staff to have volunteers coming in, because we could screen our staff and have a little more of a control over what was happening with our group of 15.
Right around the shutdown, or really close to it, was when we started. That was a really interesting time, because there was a debate about whether we as service providers were even going to be allowed to leave our homes to go and provide services. And so, but we decided we were going to no matter what, and because people needed us, so we were active during the shutdown, and but we did limit ourselves to clients who were homeless only at that point, and that lasted for a good part of the pandemic, where we just served people who were homeless, and strongly encouraged our clients with homes to stay home, which was obviously a challenge for them and for us.
I'll never forget that there were two very ends of the spectrum, and I think that's society at large. That was my realization that this is how we're going to deal with this as a community and as individuals. Some of us are going to run into the fire, and we're going to go head into it, and we're going to do what it takes to change things, to address the issues, and some are going to be fearful, and we're going to have to help lead them through this.
While our family was super careful and did all we could, all of us living in the house, myself, my wife, my son, all ended up getting COVID, as did my mother-in-law. And we never know for sure how that happens. I always try to remind people, don't blame somebody for getting sick. It's not their fault. It's the disease. It's the virus that's the enemy. Not we all do the best we can. We try to. So it was very difficult. Very early in April, my wife Dawn got sick and went to the hospital. She was sick enough. She was at home sick, and then the breathing got difficult, oxygen levels and such. And we took her to the emergency room, and I didn't see her for another 11 days. It was that kind of goodbye at the emergency room door, because we walk in and they had to take her in. At the same time, her mother, who we had helped move out of the congregate facility, was in Pennsylvania, and at the same time she got sick and ended up having to go to the hospital. And Dawn survived, thankfully, got great treatment at IU Health, but it was terrifying and scary. And her mother didn't. Her mother passed away from COVID. So very early in this pandemic, it was really evident to me the stakes involved and the danger, even if you're super careful and you're relatively healthy, it can take you.
One of the most frustrating parts of quarantining and doing my research at home, and also doing county government work at home, and many Zoom meetings, is that we don't have good internet. And we have DSL, but we're at the end of a DSL line, so it's just one step above nothing. And you might guess that improved broadband coverage for our county is high on my priority list because it's a personal thing, but it's very much a public servant matter because I see my neighbors who are in the same boat as I am, and they know how hard this is. And we are going to get improved broadband. There's state money, there's federal money, and there's the American Recovery Plan money. So.
And we all, at that time too, because of the need and having the people to do it, we started a community food and supply drive in the Crestmont neighborhood, and had parents tell us what they specifically needed. Then we put that up on a digital board that donors would go in and say, I'll take care of that. They brought it to the Crestmont Club, and we then wiped all that stuff down, packaged it, and distributed it to all those families. And at the height of that, we're serving about somewhere around 600 people every time that we were running that program. So it was a big undertaking to do that, but it was good thing to be doing. Needed it at that point. A lot of people were fearful about going to the grocery store and all that kind of stuff. So our parents really appreciated that.
But I mean, if there's anything I've seen from day one at Boys and Girls Club, there's not a question of do we serve. If there's a need, we're going to figure out how to serve it. So we went into just this kind of mass brainstorming mode, and working with MCCSC and working with RBB to try to get ideas of how many kids are we talking about. And this is something we'd never done before. Housing students while they're doing e-learning for the full day. So we not only had them during school hours, but we had them during their after school hours too. So it was quite an undertaking. But Wi-Fi, Wi-Fi became the big topic. How do we get Wi-Fi to all of these kids? I know the schools are working on how do they do that in neighborhoods in the community, and we had to do that in the club. We could not have done half of what we did in COVID if it wasn't for the community around us. So, the community foundation, as well as a lot of groups stepped in and really helped us do some things to boost our technology, boost our Wi-Fi, boost our infrastructure to be able to handle that demand.
Well, on the Ides of March in 2020, I got a call from a friend whose mother is a pediatrician in southern Indiana, and this woman was desperate for masks, had no access to PPE, and was there anybody who could make masks? And so that's how I started, and by March 20th, just 5 days later, Kelly and I were full bore doing mask drive.
But yeah, 7 days a week, and for the first month and a half or so, we were both working 12 to 18-hour days every day on mask drive stuff. It was a true emergency at that point.
Our team set up a drive-through testing site, and through the cold winter and everything, and people would drive through and we would swab them, and then we would get them hooked up to the application where they get an email or a text and telling them their results and check in on them. And so that was the early testing that we were able to put in place. Now we've got testing just about everywhere, and it's rapid testing. So we've come a long way in 20 months, but in the initial stages, all there was the testing that we had. IU, quickly, because of their student population, they were able to stand up some great testing. I will say on behalf of the healthcare system in this region, we are very proud of Indiana University and what they were able to do. Very few universities in the United States were able to manage and test and keep the positivity rate and the spread of infection at a low as much as they have been able to do, and the investment that they made. we can be very thankful because those additional 40+ thousand people in our community could have really taken this community to a different level and overstressed our healthcare resources.
I think just thank yous. There's just a lot of thank yous. We could write about 5,000 thank you notes that we would like to send out, but just thank you to everybody who helped make it possible. I mean, I think lots of people said, "Oh, Boys and Girls Club, you guys are doing so much. I can't imagine the work you're putting in and how hard it is." And it just was hard to always to say you're welcome when it needed to be said was thank you. You know, it was not something we could have done alone. So just so many thanks that we'd love to share out to everybody who brought their kid, who signed their kid up, who came in to, you know, do the e-learning with us, who supported the program in one way or another, who fed our children, who volunteered for the supply drive, and I could go on forever. So just a million thank yous.
Yeah, same, the donor base and their willingness, and other people who were just willing to pitch in wherever they could, and in particular too to our staff, the ones that initially just said, all right, I'm in. And not all the answers were there yet, right? We were going on what we felt was right. We didn't feel like we were putting our people at great risk because of all the research we did, but they still, went and did it. And that was a big deal. Very grateful for that. That was impressive.
One of the first meetings I had early pandemic was with Jeff Meese, because they have, the One World family of restaurants, and he wanted to, support us, but at the same time, he was also asking me, well, we want to support our restaurant family, like our employees and so forth, and they created a community dinner, where employees of any local restaurants could go and pick up food. And a bunch of restaurants, local restaurants, pooled what food they had left in their freezer and cooler to create those meals each day. And there are a lot of commendable things, but that was one of the big ones that I saw in our communities.
There were some amazing things about the way that the teachers rose to the occasion, that all the people who actually, once they got into school, there were many people who got beyond that fright factor of being in school. They told me, and just rose to the occasion. The things they did with those kids, the way that they were able to be creative, the outdoor things they did under tents, and taking their lessons outside and incorporating outside, and working so dang hard teaching online and in person. And then, what's really brutal is like being hybrid, and then having some kids online, some kids not, and then, so the amount of workload that they've just gone through is just an unbelievable, unbearable amount of work. And the dedication in a profession where you're already pretty beat down in Indiana, to add to that, this was just like, I couldn't even believe that they were having to deal with that on top of everything else. But people don't go into teaching for money. Not in Indiana, they don't. And so the way that they were able to serve the kids in the community was really quite beautiful.
Mask Drive absolutely never would have existed if it hadn't been for me or for Nola. And we were total strangers, and we did not have to decide to put our whatever differences over Elastic aside and team up, but we did. And together we created something that has already made almost enough masks to put on every single face in our city. And that's something. We've definitely, absolutely saved lives, possibly dozens or hundreds of lives with these 70,000 masks. And all it takes is the decision to step up.
So for testing clinics, we never asked for volunteers. I look back and just thinking early on, like, those people are heroes. People that are working in the hospitals, in the medical clinics. When COVID was, we didn't know very much about it, and they're putting themselves on the front line to do that. And I think about that with our people that have worked in the testing sites, like, wow, like they really stepped up. So we never did ask for volunteers there. But certainly when we got to the point of vaccination, we did. And I should have asked before I came how many volunteers we have on the roster now. So when my previous job as health educator, I also did the Medical Reserve Corps coordination. And so I kind of oversaw the volunteers. And when there's not a public health emergency, it's really hard to maintain volunteers because they want to do something. And you don't have a lot for them to do. You know, I can have some trainings. So I had cleaned up the list, and we were, trying to remember, we maybe had 60, 70 people. And that included our staff. So we probably had 35 volunteers. Now, there's, I want to say 500, but I think there's probably well beyond that even.
Oh, wow.
People, yeah, it's overwhelming. It's, and they're, you know, they're all different ages, all different knowledge level. And the great thing about the volunteer program is we can find a place for anybody because we have so many different things. You know, you don't have to be physically even there to help. We have people that make phone calls and so forth. You know, we've even worked with IU students for volunteers, making phone calls for appointments to make sure people have all their questions answered, have all their information input. So there's lots of different roles, but yeah, the community has stepped up in an absolutely huge way to volunteer for this response, and they continue to do so. You know, we continue to have outreach clinics. You know, we've done things with the Latino and Hispanic population, with homeless, different areas of the Crestmont area of town, you know, and we continue to kind of roll those out. And I would say there's a core group of volunteers that really do probably volunteer more than others, and really kind of, we could almost turn it over to them to run a lot of it. They have so much knowledge, but they're all so important to us, and we're very thankful for them.
The decisions that the IU made affected the entire community.
They're very intentional and very community-based, because, again, I just can't, it's like, so proud of them for, like, you know, listening or, like, doing the right thing for public health, because, like, it's a virus. It doesn't know if you go to IU or not, or if it's
like,
across this.
Let me look at your ID card first. Okay, yep, we'll pass you by.
Exactly, so.
Yeah.
No, absolutely incredible. We're all about prevention in public health, and, like, never, it's so hard, prevention is such a hard sell, like, it's so hard to say what I did caused that thing not to happen, right? But I have no doubt we saved lives, like literally just the law of large numbers, with that many testing, with that much isolation and quarantine, with the things and the policies, procedures, and the restrictions that we put in, like, we've had to have saved lives, like several probably, and it's a different feeling. So I'll take that with me forever.
They got a survey together after school ended in May and asked people how their online experience was, what would they, you know, they did a huge community-wide survey of parents, and then they surveyed children, the high schoolers, how was your experience, what do you think worked best and what didn't work best. And so they used that kind of input. There were hundreds of emails. And we got every one of them, because it was important for our school board members to see what the information was that the superintendent was getting. And as it came to the decision where we were going to vote on the reopening plan, they, you know, I was having my own, like, panic about what's healthy, because we were getting so many people writing, don't open the schools. It just, starting the beginning of July, or was it at the end of June, I think, that we voted on the plan. But immediately after people started saying don't open the schools, we were getting letters that were, emails that were saying, don't send our children back, don't send our teachers back. We don't want everybody to die. And constant, like, and only send back the kids that need to send, you need to send back, don't send back all of them. And then I've been an advocate for public education for like 10 years before I became a school board member. Everything that I've read really speaks to the fact that children need to be in school in person, and that school is vital to their lives, to their well-being. It's not just about reading, writing, and arithmetic. It's about social skills. It's about, you know, having a space where they're learning about their identity outside of the home. But then it's also true for so many kids, as I said earlier, that this is the only place where they're going to get fed. It may be for many, many kids the only safe place in their lives. And so we were reading about the shutdown, and or at least I was reading about the shutdown, and the number of calls that some of these emergency numbers were getting of kids that were suicidal or being abused. And, you know, for a lot of them, they were being forced to be quarantined with their abuser. And for a lot of women, a lot of families. So there was a lot of extra reasons why school is an essential, necessary thing in kids' lives. And so I knew that. But what I didn't know was, where is that line between that vital work of children's lives and being responsible for a pandemic and the spread. And that was the thing that I was just really struggling with. And there was no clear metric or anything that anybody was saying what we were going to do. But people were rising up and getting more and more upset and angry, and teachers were getting more and more frightened. And other districts were already calling it so early, like in August, you know, like I think Wisconsin's Madison called no school from last summer and have not had an in-person school day yet. But in any case, so people were writing and they were saying, you know, so and the teachers were starting to get upset. And so then my thing was like, well, so we're in between. You know, you've got the administration saying this is what we have to do, we serve kids, and you've got the teachers saying we're scared, and not really seeing essential worker as their title. And then instead of like going back to get a new plan, what the teachers wanted and what the community wanted was some kind of metric. Like, how much is the percent positivity that needs to be? What are the metrics that are going to say that it's safe enough for people to be in school? And what does that look like? Does that mean all little kids are in, or is it only half the building in, or every other day? How does that look? And no one had like the right decision on that. No one's had the right decision on that. But so they kind of went back to the drawing board about how to make that. And the superintendent created a metrics committee. The school board said, fine, you know, brought epidemiologists and pediatricians and people from IU Health and the teachers union and a couple of teachers, I think, and different people from different walks of life to parent and stuff like that, to talk about what is this going to look like. You know, we don't know what their life situations are. It's not for me to judge. It's how I ended up feeling about it. And so it was very important that we land on the side of kids, because they don't have agency, but the adults do. And it's up to the individual situation of those families to make the choice for their kid.
And then I got asked, because I was one of the regular ushers at St. Mark's United Methodist Church, and we weren't meeting, but I got asked to help with the Health and Safety Committee, which was planning when are we going to go back, how are we going to go back. And so I ended up drafting the plan that we would use to reopen. But I did that last summer based on other plans I found from other churches, and we are just now in April opening next Sunday for the first time with a maximum of 50 people. And I will say there have been lots of folks who really hoped we could be open by Thanksgiving or Christmas, and thought surely it won't be that long, and it of course was. And then they really hoped we'd be open by Easter, and we said no, but we finally said, all right, we will.
at this point, I think people are figuring out, we have to learn to live with this. It's not going to go away. So how can we safely see each other? I don't think we're ever going back to the old normal. I think there will have to be a new normal. And that may mean that people like me who used to come in and hug half the people in the room will not hug that many people anymore. I think there will be just things that we're going to have to learn to do differently.
First come, first served.
First come, first served. We're asking that people have their vaccines, but we're not requiring a passport. We're just asking. And if you have a health condition, would you please stay home and for a little longer? We're trying to find nice ways to say what needs to be said to help keep people safe. And we'll require the masks and hand washing and social distancing. And we said all that in that first draft of the plan. And we got the temperature, the thermometers that you point at somebody's head.
Mm-hmm.
And we've got sanitizer at every entrance. And we have, I think we will have extra masks because obviously if someone comes without, they either have to wear one of ours or they have to go home.
We were really blessed. Our staff had no problems stepping up and getting vaccinated. As soon as, I remember when they opened it up for teachers, we were able to get in at that point, and almost all of our staff was vaccinated within the month. So it's good for us, and we want to share that as well. And especially with the Crestmont neighborhood, there can be access problems there. Not everyone has the transportation. So it was a no-brainer to be able to open up our gym. And I mean, when the health department asked us to do that, Christina especially, I was emailing and calling these people at least once a week from my start date through the end of the year. I mean, we were constantly evaluating with them, can we do this? What about this? How do we do that? So we were so grateful for them. I mean, it was just a simple thing we could do to turn around and help them. And it was great to see that day. I remember we would see parents come in, because it's the same time that pickup was happening too. So parents would come into the gym, go get their vaccine, and then come and pick up their child. So it was really neat to see that it's not just helping the community at large, but it's also just helping our kids be a little bit safer and their families be a little bit safer.
The risk of the vaccine is microscopic compared to the risk of the disease.
Yeah.
Not just dying, but the long-term sequelae. And if you don't know what those are, don't be second-guessing the experts. Get your vaccine, because that's way safer than getting the disease. And you might get the disease and not have a whole lot of symptoms. You might not get real sick. But it's like Clint Eastwood. Remember that one? Do you feel lucky today, punk? I don't know how many shots I've fired out of this pistol. Well, that's what it ends up being. If you really feel lucky and like you're invincible and you'll just get the disease and skate home free, that's a bad bet. Compared to the shot is nothing. It's almost nothing.
Yeah.
Virtually nothing. I had my second one, first one on my shoulder was just got barely sore if I pushed on it, but I didn't notice it all day. And it was gone the next day. And the second shot, and I got Pfizer, but they're all about roughly the same. The second one, the second day I was just a little tired. Not quite achy, but just kind of out of sorts. The next afternoon I slept, and next day I was totally 100% well. And what that is your immune. That's evidence that your immune system recognizes this dead virus, not live virus, dead virus, that and it ramps up the response, the immune response to the virus. So. That's not necessarily a bad sign.
Yeah.
So it is minor inconvenience. Minor.
Right.
It is a major inconvenience to get the disease and get the long-term sequelae. That is a major, can be major.
Yeah.
So, all kinds of bad things happen when you get the can happen. Don't necessarily happen, but might happen when you're way longer list than getting the vaccine. Vaccine is really not much of anything.
But I think people are very tired. Everybody is tired. They want to get on with their normal life. And our best way to do that is vaccination. But hopefully people will see that. So as our vaccination numbers rise, as our cases diminish, and we've seen that, with that older population, we are not seeing cases. I mean, we see some, but not necessarily because they've been, that person's been vaccinated, but we're not seeing infection in them. We have not had a death in weeks, right? So those are all good things. That should be something that tells you if you get vaccinated, we can stop this.